are we at the point where we should ask ourselves how many serious illnesses per day or deaths per day from COVID-19 is acceptable before much tighter measures have to kick in? And is there a way that we as a society can come to an agreement on what this figure is, this morbidity figure is? Thank you.
I mentioned 1,000. As I said earlier, 1,000 is what we can possibly stand up, but we really don't want to go there because it will degrade our hospital services, and it's a contingency plan that we hope remains in the drawer. Yeah, what we can almost very quickly do is to ramp up to close to 300, and that is the capacity we can handle from a capacity point of view, not from the point of view that we are setting a target for 300 ICU. What can society and ourselves accept at what level of ICU and morbidity? I think it's something we will have to watch, observe, and we hope that this is as low as we can.
One should not underestimate exponential growth. Don't be lulled by 7 cases in ICU and therefore we got so much headroom. Exponential growth can change the situation in a few weeks' time. And that's why our main concern now is not even talking about steady state, what kind of mortality rates for the whole year. That's a separate conversation which we can have later on. And indeed, once we start living with COVID, we must, as we have always said, expect more cases, more deaths from COVID. Yes, in steady state that will happen, but we are now focusing on being in the midst of an exponential wave of cases, which will rise very rapidly in terms of the infection numbers in the community, but we don't know yet what will be the impact on our hospital system. And that's why we are just asking for a pause over the next 2 to 4 weeks so that we can look at the data, understand the patterns of transmission and how it might very well follow through to severity and severe illnesses, make sure that our hospital system can cope before we decide on what the next moves might be.